Testosterone replacement therapy, TRT, can effectively prevent or correct anemia in men with hypogonadism, a new study finds. Testosterone deficiency is often an overlooked cause of anemia in older men. Yet nearly 15% of older men with hypogonadism experience anemia. In their randomized clinical trial of 815 men with anemia and hypogonadism, Traverse Anemia, a significantly greater proportion of recipients of 1.62% testosterone gel than placebo gel experienced a hemoglobin rise to the threshold of 12.7 GDL or higher over 6 months, 12 months, 24 months, 36 months, and 48 months. The proportion of men whose hemoglobin increased by more than 1.0 GDL was significantly greater in the TRT than placebo group at all time points. Among 4,379 men without anemia at baseline, a significantly lower proportion of recipients of testosterone gel than placebo newly developed anemia at 6 months, 12 months, 24 months, 36 months, and 48 months. The rise in hemoglobin was significantly greater with TRT at all time points by approximately 0.3 GDL. At 6 months, anemia correction was a significant 2.0-fold more likely in men taking TRT than placebo, the investigators reported. The risk for new-onset anemia was 31% lower at 6 months for men taking TRT. According to responses to the Hypogonadism Impact of Symptoms Questionnaire, HISQ, hemoglobin increases were associated with a small improvement in energy score. With respect to adverse events, as previously reported, non-fatal cardiac arrhythmias, but no major adverse cardiovascular events, and acute kidney injury occurred at higher frequencies in testosterone-treated patients, especially in men with anemia. 6 men discontinued TRT due to excess hematocrit. The Traverse Anemia studies findings of testosterone's efficacy in correcting anemia and in preventing the development of anemia will facilitate a more informed appraisal by clinicians and patients of the potential benefits and risk of TRT in middle-aged and older men with hypogonadism in whom TRT is being considered. The investigators suggested multiple mechanisms for anemia and inflammation correction. Testosterone stimulates erythropoietin transcription, increases iron availability by suppressing hepcidin transcription, increases myeloid progenitors and maturation, and improves red cell survival. This anemia trial was a sub-study of Traverse, testosterone replacement therapy for assessment of long-term vascular events and efficacy response in hypogonadal men. clinicaltrials.gov, NCT 03518-034. It included men aged 45 to 80 years from 316 U.S. sites who had 2 serum testosterone values, less than 300 NGDL and hypogonadal symptoms, along with increased risk for cardiovascular disease, CVD, or a CVD diagnosis. Men were started on 40.5 milligrams of testosterone gel, then had dose titration according to their serum testosterone and hematocrit levels. The prevalence of anemia was 15.7%. The individual causes of anemia were not ascertained. It is reasonable to offer TRT to men with symptomatic hypogonadism regardless of hemoglobin level. Shabir M.H. Alipai, Maryland MSc, of the University Health Network in Toronto, Ontario, Canada, commented in an accompanying editorial. I would counsel men starting TRT that they could expect small rises in hemoglobin levels on average, with small improvements in energy if they had anemia, but other effects on well-being, cognition, or function are either unlikely or unclear. Hemoglobin levels should be monitored in men starting TRT to detect the development of polycythemia, and prostate-specific antigen levels should be normal prior to start of treatment.